Occasionally, in testosterone replacement therapy, the subject of body odor comes up. Does TRT contribute to body odor? Well, it usually doesn't, but in relatively rare cases, it can. Testosterone plays its role in this by causing your skin to be more like it was when you were young. Overall, this is a good thing. It increases skin thickness, elasticity, and moisture. In essence, you sweat more, and your body is doing a better job with getting rid of the stuff it doesn't need. But the downside is it can increase body odor. The aberrant glands, which accompany hair follicles and are found in areas like the underarm and groin, are sweat glands that secrete a fatty sweat, comprised of toxins and other things the body doesn't make. Unlike the clear sweat, which is mostly just water, that comes from the sweat glands on the rest of your body, this sweat is actually a milky fluid. So in body odor, there are two overall ingredients. The first is that fatty sweat I just mentioned, and the second is local bacteria, which exists in those areas on the skin. When the fatty sweat is excreted, it really doesn't have any smell at all. But then the bacteria present begin to break down that sweat, and it's this decomposition process that actually causes the smell. What primarily dictates what this smells like and to what degree is the composition of the fatty sweat. What's it made of? This is determined largely by hydration, diet, use of alcohol, certain drugs, certain supplements, and nicotine. The most common tactic to get rid of body odor is to block the skin pores that the fatty sweat comes through. The idea of blocking the pores so the toxins can't get out doesn't sound like a good idea to me. So maybe the use of a deodorant as opposed to an antiperspirant is a better option, especially those containing aluminum. Another suggestion is to wash those areas regularly with antibacterial soap to decrease the amount of bacteria present and to trim the hair in those areas so as to make the environment less inviting for bacteria to live. If you want to fight it at its origin, however, which I would say is the best option, look at changing the recipe of the fatty sweat by avoiding processed or greasy foods. Make sure you're drinking enough water to stay well hydrated. Eat lean meat as opposed to fatty meat. Avoid foods that are known to produce odors like onions, broccoli, and garlic. You can discuss reducing DHEA or other supplements that may have an effect with your TRT medical provider. Testosterone optimization is a life changer for many people in virtually every aspect of their lives, particularly as they get older. Don't let something that's pretty easily dealt with, like body odor, inhibit your growth to being the man or woman you want to be.